And actually, he has a great network and is talking to so many people. And what's really amazing is that you get completely different views on things that you say, okay, actually it's clear, but if you come from a different point of view, you get a complete open mind and start to think different. And so today we saw already a lot of presentations, what has been done already, and now we want to talk about the future of healthcare and just get also some visions and ideas how it could influence our work. So thank you for presenting and enjoy.
Of course, thanks for the introduction, Axel. Of course, it doesn't work the way I wanted to. I wanted to be really cool and use the iPad and the iPhone as a guide, but it doesn't seem to work. So I may have to run back and forth and actually switch the slides. So let's try this one here. Is it running now? So next one, it should actually do a little bit. So it doesn't do anything. But then we have a problem.
We need to use standards.
Actually, maybe in the meantime, while the technical department is trying to fix this, I think, thanks for the presentation. We just had a quick discussion with Axel, and I think we are really illegal. So we are actually uploading all of our IEEE papers right away into ResearchGate without asking anybody. And so we know that we should not do that. But I thought open access and common attributes means you can actually do that as well. So I guess we're wrong with that one. So let's see if it works now. Now it should actually flash a little bit. Yes, very good. So this is the title that I have been given to, Healthcare Now and in the Future. And of course that's just the title because I will talk about a little different things anyway. And but I want to do is I want to take a little bit on a journey in the future. So this is not going to be a very technical presentation, but rather a presentation about what I believe you guys should do in the future. And what I believe you guys should be involved in, and what I believe that you guys should actually thrive to achieve. So let's start. It's still not working here, right? So let me try this one more time and this thing. So yeah, it works actually. Here we go. So this was the title. Global Young Professionals Addressing Today's MedTech Challenges. What are the challenges? Anybody have an idea? What are the challenges? I mean, it's very easy to put that down as a word, but if you don't know what it means, it's a problem. So I will tell you a little bit about these challenges. And of course I will talk about the future, and as I said here, and you probably should note in the future anyway, don't ever listen to an advisor. Don't ever listen to anybody who's trying to tell you what will happen because they have no idea what will happen. They can only assume that certain things will happen. Hands up. Only believe this will be the future? Well, I do actually. How many years? But that's a different story. We'll talk about timing later, no? Will that be the future? You know what that represents? Data exchange. Yeah. Of course that will be the future. Data is the new currency. You've heard that one before, right? So, by the way, I stole all these things from GE, so I was ready for GE. I did not put it down there, but I used it so many times that I thought people would know it. So, is that the future? Yes. Maybe. I hope not. That's my hope, but it may actually happen that way. But you know what? What is the most important thing on the outcome of healthcare? What is it? What was it? Quality of life. Yeah, I want to live very long. That's my goal. I don't want to die early. Who wants to die early here? So life expectancy is a pretty good measure of healthcare. And I think that's a very valuable outcome. That's a very valuable measure. I got some bad news for you. People who are here in this room and trying to improve healthcare by creating devices and improving life expectancy by creating devices and workflow. Life is not dependent on healthcare. Life is to a large extent dependent on socioeconomic factors. So, how well are you educated? Where do you actually live? What is your family life? How rich are you? How much money do you have? This is to a large extent dependent on how healthy you will be and how long you will live. 10% is dependent on your physical environment. Where do you live? You live in the city with a lot of smog, a lot of dangers, other dangers. You may be murdered or some other things, right, in large cities. Where do you live? And 20% is dependent, or 30% is dependent on how well you live. Do you smoke? Do you drink a lot of beer? Do you walk around, move around? 20% is only related to the healthcare part. These are just simply numbers. Now, if you look at that, you have to question yourself on whether we're actually doing the right thing. We're putting trillions and trillions of dollars or euros or whatever your currency is into healthcare. Should we not put more money into better diet, getting people to move more, making the air clean, making the water clean? That would save a hell of a lot more of the issues that we can solve in healthcare. Now, I didn't want to depress you or anything because you're working with biomedical, but we are not working very often on these issues. Now, you've heard that one maybe before? Healthcare will change dramatically. You always heard that one before? Every time I go there, the healthcare is dramatically changing. And then you talk to the doctors and they say, yeah, not really, we do still the same stuff, right? So the question is, why do we actually believe that will change? So, anybody has a quick reason why they believe that will change? I'll give you some later on, but a couple of them is, we need to actually also ask, when we know why things change, why do they really need to change? Is it not good the way it is? And we also need to also know of what that means for the future of us, our education, our future work, our training. I'm a big fan of actually questioning the biomedical engineering education completely. I'm a big fan of questioning the medical education for that. Now, I seem to be somebody who preaches this and nobody listens. That's okay. But you have to maybe come up with yourself on whether you believe that certain things need to be changed and how you can actually be part of this changing process. So I hope that I can reach with this little presentation that you have a little different thinking process, and that you maybe have a little bit of an understanding of what may happen in the future and how do I adjust my own thinking and my own work based on that. So this is actually the goal that I have for this lecture. So, future of healthcare. So this is a really bad copy. I copied it from one of the presentations that I go to that Axel mentioned because I always go to with all kinds of clicks, right? And it's actually a bad chart because there should be a slash between system of today and future. But if you look at that very carefully, the left one is where we are right now. The right one is the one we possibly should get to. So we are doing reactive sick care. You've heard that maybe before. When do you go to the doctor? When you're healthy? Yeah, but you go to the doctor? No. You go to the doctor. I'm happy, right? So you only go to the doctor when you're sick. Yeah. And how much money does the hospital make if you don't go to them? Nothing. Of course not. They only make money when you go to them, when you're sick. So it's sick care. Everybody only benefits from the healthcare system when you're sick. Now, obviously, the thinking process should be, why don't we prevent things from actually happening that we get sick? And we don't ever have to go to the doctor. Do you think the doctor would really like that? Or the hospital would like that? Nobody comes, we have the hospitals, but nobody comes to them anymore because nobody's sick. Is that a good business proposal to open up a new hospital? Not really. I'm not saying that that will necessarily happen immediately, but we can always formulate wishes, right? And the wish would be, no, I don't get sick anymore. I will make everything possible to not get sick anymore. Remember, one more time, the chart I showed you before, 80% is dependent on completely other things. Depending on how well you eat, what your family environment is like, the stress level is like, etc., etc. Those are the things you can maybe actively control and maybe even influence. Now, you have a problem with your hip, right? You need a hip replacement. What do you think would happen to you? How many, would they actually replace it based on your current hip? You know, all fitting very well together? No, you get just 1 of 4 sizes, it's fine. There's no individualism. There's no personalized approach to the whole thing. Why is there no personalized approach? It costs too much money. It's too effort. We're working on evidence-based medicine. What does that mean? That means there are some results, some previously published results, and we follow these rules. We don't really measure how precise this treatment is. We don't measure whether it creates a value-based medicine. We've heard that one before. And we don't do a personalized approach. We basically say, we just pick somebody here, I hope I get the age right, so between 30 and 40, right, Caucasian woman, and when I look at my statistics, it's probably this. That's what we have. This is kind of like how we do medicine. Now, do you want that to continue, this medicine? No, I don't want that. I want actually a treatment that is geared and that's really focused on Michael Friebe. I don't want Axel Größ's medicine, I want Michael Friebe's medicine. And we need to make sure that that actually happens. So what we have today, and that's actually why I say we have a problem, sick care. Remember, if you don't go to the doctor doesn't make any money. If you don't go to the hospital, you don't have anything. The hospital doesn't do anything, the hospital does not make any money. We have profits being significantly more important than patients. Now, should we not be the other way around, that the patients are actually in the center of the healthcare, and you deal around the patient, rather than dealing around the economic aspect? And by the way, I'm a pure capitalist. So don't get me wrong, I'm not a socialist, I'm not preaching any communism or anything. I'm just preaching that healthcare, as far as I'm concerned, is a basic requirement and a basic need, and there should not be a distinction of whether you come from a poor country, from a rich country, or whether you are self-poor or you're self-rich. There should be no distinction. I think this is completely highly unfair, and it should be changed. So I think we should change that. So, does anybody know what nimble means? Well, in that context, it should make sense. Nimble is exactly, I did not know that, by the way, myself. Nimble is the opposite of agile. You know what agile is? Right, go around, right? Nimble, let's wait and see, let's not do much. Healthcare is nimble. Healthcare does not like change. Because if it is changing, then the whole workflow and everything has to change. So it's very, very difficult to get anything changed in healthcare. Nimble. So how do we change a nimble system? Good question, because we need to do something. It's also highly bureaucratic. I show you a chart later on from Eric Topol's book, where it basically says how much time doctors spend in their patients on average. The average time a doctor spends with a patient is 15 minutes, of which he actually spends with the patient 3 minutes. And the rest of the time is doing something else. 3 minutes! How can you actually find it? I mean, I say he, by the way, I don't let the women get, I mean he and she, right? They don't have any time. Because they need to actually get the patients from the waiting room, they get them out. Now, how many of you, this is a little quick question in between, how many of you like going to doctors? I think it's getting better when you get older. Yeah, we have some talks, we have some people who chat, how is your hip doing, my knee is fine, by the way. How many people like to go to the doctor? Nobody. So how many people would rather actually cure themselves at home? Now let's ask a different question. How many of the times you have to go to the doctor, you think you have to go to the doctor, you think, I really don't have to go to the doctor, I know what I have. I need the damn flu medication, that's all I need. But when you go to the doctor, get a prescription. You know what you do? Just think about it from a workflow process. You're schlepping yourself in a sick condition. You go to the doctor. How many healthy people sitting in doctor offices? Not many. They're all sick. Do you get healthier when you're surrounded by sick people? Typically not. You get typically sicker. So in your sick condition, you go to a doctor office which is surrounded by sick patients, and the only thing you would have to do is actually, now we're using Alfredo's technology, we are actually coughing into a phone. We previously had actually probably put a baseline cough in there. That's a good cough. And the system recognizes that. The system also recognizes that could be a pneumonia or not, or something else. There's AI behind it, right? It says, based on your cough and your temperature and the visual inspection of your stress level, blah, 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 you probably just need medication and go to bed. Yeah? And by the way, the pharmacy will come in 1 hour to deliver the package. Would you like that? Hands up. Come on, hands up. I want to see some action. Hands up. You would like that. Everybody would like that. Now tell me, is this possible technology-wise? I think it's all possible. I think it's all there. I don't know exactly what we need. We just need to put tight together. You know what's missing? Nobody makes money in this system. Like, who gets paid for it? So these are the questions we need to analyze and ask, and that's also the reason why we need to change healthcare systems, because healthcare systems are not geared towards these kind of things. Now that's why I'm also trying to tell my students that if they look at market potential and they look at Holland or Germany, which is pretty much similar to the market perspective, and they will not find out that there's anything they can do because it's a tied up system, it's very close, you can't enter it, should they give up? No, they should look into India or Africa. Maybe there's opportunities there. And if you do that, you will find out that other countries have a completely different need base, and probably your product, your idea will actually be very helpful. So I think I'm losing myself again in my chatting, so I'm going a little quicker. So every healthcare system faces a tractable problem. So 50% of healthcare is not evidence-based. So these are just facts, right? Care continues to be episodic versus integrated. So when you're sick, you go on, but nobody takes care of you afterwards. And yourself, you don't take care of it either. 10% of the patients experience harm in hospitals. Harm in hospitals. Where are the germs? Where are the bacteria? Where are the viruses? They are actually collectively in the hospitals. And the ones that are in hospitals are very dangerous. So I could have more statistics on this one. I'll give you another one first. This is cool. Please don't leave. Of course, when I say that, everybody reads it. Don't leave the one at the bottom. What is this? Read the one at the bottom. Rude, hurried, rushed, busy. This is the patient perception about the physician in 2 words, the good, the bad, and the ugly. Journal of the American Medical Association. Highly respected journal. This is the representation of what the patients think the doctor is. You could also say he's an a-hole, right? But this is exactly what comes out. Arrogant. And would you consider that a problem? I do. And I believe technology could actually help. But we're not really necessarily introducing technology to this, to solve these type of problems. Now a little rundown on more problems. 30% of care provider is useless. Number 3 cause of death is medical errors. Number 3 cause of death. You go to a doctor to get treated and to leave the office practice healthy, and the number 3 cause of actually dying is because of medical error. That's a real big problem. Okay, a lot of other things. I actually make these charts available if you want to. I can upload them. So whoever's interested, that's why you won't have to go on it. So we have actually decided that the most important thing is for working in the innovation field is identifying the problem. We don't really look at the solution, we look at the problem. And I would really urge you, and I hope that I will be a little bit successful with this, is try to understand the problem deeply, intensively, and try to analyze not only the problem, but what will happen with this problem in the future. If you know that, if you have a little bit of an understanding of that one, you can actually create solutions that are not valuable right now, but maybe valuable in 3 years, or 5 years, or in the future with different business concepts. I like to quote Steve Jobs on that one. He was obviously very cool, because what typically happens when somebody wants to create innovation, you go to a doctor, so and how would you create innovation? What would you do? You would ask, what's wrong? What can I do for you? What can I innovate? And what's the answer? Typically, what is it? Everything is good. If everything is fine, you guys can go home right now. We don't need you. We don't need any innovation. It's all good. And if he tells you something, or she, what will that be? Something very simple. Something like, oh, I use the scissor like this, but I like to use it like this. Can you do something? Yes, you can. Does it solve healthcare problems?
No.
Not really. I think not the big ones at least. Right? So this is typically what you get. But if you dive down in understanding the problem, you may actually see that's what he tells you. But if you understand and look at how it works, that's why we have this innovation lab, by the way, then you actually may get a completely different picture. May also be wrong, but you need to iterate and find that out. So please, if you take only one thing back from this presentation, is dedicate time to the problem. Don't start right away in the lab and create and build something. So Topo, the one I referred to already, by the way, I'll mention him later on one more time. He's written a book called Deep Medicine. Please all buy Deep Medicine. Buy this book and read it. Incredible information about, in very, very layman's terms, on what he believes from a medical perspective, a clinician's perspective, will happen in the future of healthcare. Very important, I think, if you want to create innovation. So what has happened? Just look at the numbers yourself. I think it's pretty obvious, right? 4 million numbers of jobs in healthcare just about 40 years ago. Now we have 16 million. Population has not gone up by a factor of 4 at the same time. Interestingly enough, healthcare spend per person has gone up by a factor of 20. Most expensive truck has gone up by, I can't even calculate this, 500, right? Something like that, 600. Time allotted for office visits, the doctors were less, but had more time. Interesting. And now, that's very interesting, it's not in Germany, but in the US, you spend almost $5,000 per day in a hospital. So think about this, if you don't have health insurance and you make $100,000 a year net, which is a lot, and you get injured and you have to go 2 or 3 weeks to the hospital, you're broke. Is that good? I don't think so. We need to do something about this. So I believe that we have actually technology solutions, but we don't necessarily implement them. Because we do more what I just described, these incremental innovations. We want to make things a little better. Just a little better, 10% better, but we adding 30% cost by making it 10% better. I'm not sure that's really a good economic balance. So another guy I recommend you to read and to maybe sign up for is The Medical Futurist. It's Becker Lamesco, also a clinician, a futurist clinician. He has a very good blog, and he writes all kinds of books. You don't have to believe everything these guys say, but you need to actually enter it in your system and try to work with it. And try to maybe pull it up every once in a while. I think I've heard that that will not happen, or that will happen, or might happen. So please inform yourself about these things. So he's saying there's a lot of things wrong, and one of the things is that we are actually having shallow medicine, very superficial medicine. So staying with my cough, I go to the doctor, I look kind of pale, I'm otherwise a healthy person, I start coughing. What do you think the doctor thinks what it could be? There's about 150 different diagnoses for this topic. What does he think it is? Yeah, he looked at obvious, right? The obvious thing. So he has immediately, as you enter the door, already reduced the 150 potential diagnoses to 3. And he's checking you for these 3. He will not check you for the other 147, because he thinks it's not happening. Now, would that not be good if you had a system that would actually pre-check you beforehand, and then kind of like selects the ones that the doctor should really check? Is that not possible? I think it is possible. It's already possible, or at least it should be possible, and will be possible in the future. And all in all, we also have a lot more diagnoses than we actually need, but we don't focus on the treatment and on the prevention of these kind of diseases from happening. I mean, I always look at the CT scanners, the MRI scanners. I'm an MRI physicist, by the way, so I love MRI systems. But if I look at them, I say, cool, what they can do. Who needs it? Who needs to have 0.25 millimeter resolution if the best therapy you can give is 2 millimeters? What do you need that for? What do you need to spend 1.5, 2 million, $3 million or euros for an MRI scan that can do that? If the therapy has no consequence, there's no consequence based on that. Should we not actually invest more money in reducing the cost of the MRI and put more into prevention? and make it so it fits the cost. I'm not saying that we should not have any abilities for MRIs anymore, but they should not be used for doing a knee scan, which you can see with other things as well. Why do doctors do that with the MRI in the US, for example? No, litigation. Main reason, litigation. They are afraid that they get sued because they didn't do things. So you do a lot of things that you only do just to be complete rather than because it was necessary. So, what should be the goal of biomedical health innovation? 4 points. Can you tell me something? Affordability, cost. I think cost, put this up, most important. Now this is not very scientific, right? Science people like to do new things. They don't like to reduce cost. Reduce cost is by far the most important thing to make healthcare better and affordable. Access for everybody. Access for everybody. It's not on there, but you're absolutely right. Actually, maybe we can call it the next one, improving patient experience, because these people do not have any patient experience. If you don't have any doctor, what happens? You stay sick. You may get healthy again. You may use your own little home remedy, but you don't ever go to a doctor, and you don't go to a doctor particularly when it's necessary. And if you know it's going to cost you 3 monthly salaries to go to the doctor, you will only go when you're really sick. And of course, reducing errors. And now, what Ivan said, for me important is, and I think that's what we are not working on, is that everybody has access to healthcare. What the Germans typically do is that we don't care about India. We don't care about Ethiopia or Tanzania or whatever. We care about us. I don't even blame them for that, but that's what we care for. So we want to improve our life, we want to improve our healthcare, we want to improve what we are exposed to. But in all honesty, we don't really care what's going on. I think that needs to change. And I think it needs to make that, we need to make sure that everybody on this earth has the same access to healthcare. Give you one quick number in between. The life expectancy in the developed world, or the rich world, whatever you want to call it, is going steadily up. So we have reached about 82, 83 in the meantime. And the US, which is also a rich country, has gone like this. The last 3 years it went down. And the explanation for this to me is, I'm not sure that's absolutely correct, that you can get the best healthcare in the world in the United States if you have money. If you have no money, you don't get anything. And the gap is huge between people who have money and have no money. And that is a problem as well, and I think we need to actually address that as well. And I think there's some discussion here, so I'm not sure that will happen with this current president, but there needs to be discussions in that respect. I think it's a responsibility of governments to actually take care of their people. So I'm a big fan of innovation, and the question is always, what is innovation? So this I stole, it's a new one, but I'm giving you my own explanation in 1 second. It's the intersection of desirability, viability, and feasibility. Innovation is very inflationary used, very often used. Well, we are innovative. Why are you innovative? Are you viable? Are you desirable? Are you feasible? Or are you all three of them? And as far as I'm concerned, you're only innovative when all three of them put together. If you have something that is really cool, put 3 more wheels on a car, it's kind of cool to have 7 wheels, right? Who the hell needs it? And is that feasible? Does that make financial sense? No, it's kind of like cool. It's not part of these 3 of this intersection. You need to be able, if you have an idea, you need to be able to actually make sure the patient will actually ever be exposed to it. If he's not exposed to it, it's just an idea you have in your lab, it's not innovative, it's merely an invention. So the expression I think we use is innovation is invention times commercialization. If you're not able to actually find a pathway to commercialization, you will always stay in invention. Nothing more, nothing less. Of course, you can have 3 IEEE papers on it. And maybe the measure and the measure of how we are judged as researchers should also be changing and going away from these paper stuff. Okay, so future of healthcare is also a company that I did. There's a lot of exponential technologies, and we are in general living in an exponential world. So what is exponential technologies, and why do I say we're living in an exponential world? because things develop exponentially. This is not an exponential curve, obviously, it's a negative or an inverse exponential curve. It's just showing what happened to cost with looking at the same performance, what happened to cost went dramatically down. What does that mean? That means that technology is available to everybody. It's democratized. If it's doing a good performance and it's cheap, everybody can afford it. Democratized, it's available to everybody. You know how many fixed line telephones are in Africa? How many people do live in Africa? Roughly 1 billion. How many fixed line telephones are there? No idea, few. How many smartphones are there? More than 1 billion. So on average, every African has a smartphone. He may have bad water, he may have bad air, he may have not enough to eat, but he has a smartphone. So the question is, can a smartphone not be used as a doctor, as a healthcare device? Because they don't have access to healthcare. So just look at what happens if you democratize, if you communicate cheap enough, everybody can have it. So if you would make healthcare cheap enough and healthcare devices cheap enough, everybody would have them. It would not be dependent on where you live and where you're growing up and what your ancestors are. There's a lot of other technologies on this one. The same thing is when you look at performance. Performance has gone up, and there is a straight exponential curve to that. I like showing the iPhone photo sizes, so it's kind of cool. So I don't have the newest one anymore, so I'm of course jealous now that there's iPhone 11 out there. But it goes up. You know, we have 5G coming. 5G is probably one of the most important technological developments that we will have in the next 10 years, because it will allow access to real-time data. It will allow access to telehealth, to telemonitoring, all kinds of things that are related to smartphone or related to healthcare. That's going to be incredibly important. So a lot of people always think that exponential technologies are AI, artificial intelligence, all the things you can do. And you've also heard this morning with the presentations that half of the presentations at least had AI, CNN, guns, or whatever in there. That's we need to do AI. If you don't do AI, we don't get any research funding, right? And yes, AI is quite important, but medical technology, and everybody who sits in this room is somebody who knows it, is a lot of technologies. It's all kinds. I've only highlighted the ones that I believe are important for the healthcare community. Maybe there's more of those that I didn't highlight. Those are the ones that we work a little bit with. There's a lot of things, and please remember that innovation is not just using one technology or one idea. You need to combine the things so they make sense. And use robotics combined with AI and imaging. If it makes sense, great. It's not just one technology. Now, I'm also being a little critical also about the way that we set up biomedical engineering education. In our case, it's electrical engineering. We're part of the electrical engineering faculty. What do you think the electrical engineering faculty thinks the most important technology is? Mechanical engineering? You're an electrical engineer, of course we think that electrical engineering is the biggest thing in the world. And sometimes biomedical engineering is part of the mechanical engineering department. What do you think they think is the most important thing? Mechanical engineering. And the computer science is the computer science, and whatever. At the end of the day, it's a combination of everything. I don't think there's very many things in the future where you should not be able to program. I don't think there's very much left. So there's always an intersection, and that's why I really believe for the future education, biomedical engineering is part of medicine and not part of engineering. That's my personal opinion. There's only a couple of sites where that actually is. Where's Bern? Where the ladies from Bern? Are they not here anymore? Bern is one of the few places in Europe where the engineering, the biomedical medical technology engineering is part of the medical department, the medical institution. I think that's important because you are talking to the clinicians. So please remember that. Now, I've showed you a couple more things. That's probably what a future hospital should look like. So think about whether you are actually exposed to these technologies. I also brought you a chart from San Diego where I was 2 weeks ago about what are the technologies that are basically mature, implemented, emerging. There's a lot of things that will happen in the domain outside the hospital. They will be attached to yourself. There will be wearables. There will be all kinds of other things. And we need to actually obviously think about how do we merge healthcare needs with technologies. What do we need to do? But how can we merge technologies with healthcare domains if we don't know the healthcare domains? But we know the technologies. We need to go to the clinicians, so you need to have a little bit of understanding of how they work, what is needed, and what can I do with technology. Otherwise, it will be very difficult to come up with innovation. So I'm going back to these 4 things that I believe are most important for future innovation as attributes. Innovation development, reducing costs, improving outcomes. And I brought you some examples. This one I go over very quickly. It's just digital healthcare, what people think will happen with digital healthcare. This one I jump over as well. So this is a screenshot, but all these technologies can be used in the different aspects of healthcare. So there is home care, there is long-term facility, no an elderly person or you're really handicapped or you have to live somewhere else. There is acute care, there is the healthcare practitioner's office, and there's a hospital system. All of those need innovation, and all of those need to actually work on reducing cost, improving outcomes, improving patient experience, and reducing errors. All of these need to do the same thing, and they need to, most importantly, integrate it. They need to talk to each other. In Germany, I can only give you that example. We have a separation between stationary or inpatient and outpatient system, and these guys communicate by fax. And they communicate maybe by letter. And if you went to a radiologist, you get a CD. I don't have a CD drive anymore. But that's what we get. But you ask yourself, in what kind of country are we living in? Everything is possible to transfer. Everything is possible to do, but it's not being done. That's a reality. But how can you actually come up with conclusions for the future if you're not able to watch what happened to your blood level over the last 15 years? You have changed doctors 5 times, you've changed locations 5 times, all your data is always lost. In Germany, the patient does not own their data. Well, not true, they own their data, but they don't have the data. I think everybody needs to have their data and be able to do whatever they need to do with their own data in the future. But we don't have that, and that's like a major thing that we need to do in digital healthcare, that we actually change that. So, I have some examples. On the right side, you see always the application. I think I only used home because there was too many of those. Home, and then reducing cost. This is a device. You can do basically anything. It's like this Star Trek, this Dr. McCoy thing. Oh yeah, okay, all good. This is what you can do already. Costs $600. You buy it for your home. Then we have, you can detect like diseases with your liver or pancreas, which is something that usually doesn't show up as pain, but you can actually look at the eye color. You see they have a little bit of a glasses around it to basically normalize the pictures. You can do that at home. Telehealth means telepresence. You need to be able to actually talk to your doctor or talk to someone via teleconnection rather than actually going into a car and driving out and waiting for hours in the waiting room. Why? That's not necessary. Emotion. People, there's a lot of kids who have emotional problems. They don't understand why other kids react the way they are. They don't really fit in. You need to actually give them some tools. I've also seen now from an Israeli company, it's very interesting, when you go into an emergency room there, they actually have a camera and they make an analysis of your face, and they detect on whether your face contains stress symptoms, pain. They detect that. They see on whether you actually have an increased temperature. That we can also see. They look at your eyes and look at your pupils. They can determine that. And they can actually push you forward in the emergency ranking. Yes, that's really a problem, this guy. Forward. Oh, hey, that looks like a heart problem. Send him right away to the cardiologist. Rather than waiting for hours in an emergency room or people who come and say, hey, you're not an emergency, go back home. I'm one of the people who exploit the emergency system very badly because I typically get sick if I stay healthy most of the time. But if I get sick, I always get sick on Saturdays. And I cannot get a hold of anybody, so I go to the emergency room, right? And I'm not an emergency case by any means, but I'm just blocking the emergency system because I get treated that quickly and I don't have to waste time, I don't have to wait, right? So I'm not one who exploits that, but I should be kicked out of it. So there's a lot of things. Baby monitoring, you know, is the baby still breathing, sleeping? What is happening to it? It causes a lot of stress to parents. Digital monitoring, you know, one of the biggest problems is not the medication that you give to people, but the compliance of the patient to actually follow up on the medication taking. You don't take the medication, or they take the wrong medication at the wrong time maybe, and then it doesn't work anymore. And they wonder why it doesn't do anything. So we need to put the patient, looking forward on this one, we need to put the patient in the center of our attention, which is not the case in the healthcare system right now. One time, I'm trying to give you some motivation to maybe think a little differently with types of innovation, maybe think forward what could happen with the healthcare system, and what could I develop, what could I do that actually will hit that development in 10 years. If anybody has ever read about Elon Musk has actually this projection thinking. He does something, and he does a low technology, and he knows this technology will change dramatically in the next 10 years. Computers will get faster, start to get cheaper, blah, blah, blah. And he tries to interject this development of the market so that he has the technology ready because of the further improvements at the time it's needed. Now, I'm a firm believer that Tesla is a good car, but they will not win as a car company. But you know what he will win as? As a battery supplier. He probably will supply the batteries to all manufacturing companies, all the car companies, but he will not win Tesla. He will not win as a car company. At the end of the day, he has won because he supplies the battery to everybody. You kind of like think in a little smaller terms, think a little bit, where can technology development actually interject real development, healthcare development? So Bertrand Lemestre has also shown some of the technologies that we use at home. I copied that. This is really interesting. This is from Peter Diamond. This is another guy I follow. He's the author of a book called Abundance and Bold. He's also a medical doctor talking about what will happen. And he has a nice little blog as well, a podcast you can follow. And there's in the meantime wearables, insidables, spreadables, under wearables. That's pretty interesting. You have RFID chip now you can put in your underwear, which actually measure all kinds of components. You laugh about it. There's a lot of people in the US who have one already. Tradables, invisibles, and there's so many things, but we need to make sense of the data that we have. And that's a big component of future healthcare and future detection is making sense of data. So we will have an empowered patient. Empowered patient is everybody sitting in this room right now. I have one of these stem versions, right? I've wear this for many years now. It's probably the fourth or fifth I have. I'm not entirely sure that this data, that I just love collecting data. It's not doing anything for me at the moment. And it's maybe only motivating me a little bit, or only like 8,000 steps. I think I need to go walk a little more, which is already good if that happens. But there's so much more data in this, but it's not really used. Maybe it's actually used by Fitbit, which is now owned by Google, right? Did Google buy it? I think Google bought it, right? So it's not owned by Google, which they have my data already anyway, so it doesn't really matter. But I don't know. I think this data has a value. I'm not entirely sure what, but we are very reluctant to share data. And maybe we have to change something about this too. So we will have an empowered patient who comes to a doctor and tells the doctor, I know what I have. Now, if you're a doctor, do you like this? You hate that. I mean, all these doctors that I go to, and I tell them, we can save time, I know what I have, just write a damn prescription, right? They hate that. And to a certain extent, they're still right to hate it, because I was wrong a couple of times in my assessment. But don't we believe that will happen? With better sensors, better analysis, I think that will happen. And in maybe 5 years, we do have results that are superior to what a doctor could actually find out. So I already talked a little bit about incremental and disruptive innovation. And I would like you, that's another thing I would like to achieve with this talk, is that you don't think 10%, please think 10 times. Think making things 10 times cheaper, 10 times more efficient. Not thinking, how can I improve the signal-to-noise ratio of the CT reconstruction by 3%? Is that really solving major problems? I don't think so. So think a little bigger. Now it's very difficult if somebody pays you and tells you, please make it 3% bigger, and you say, I would like you to make it 10 times cheaper. He says, well, then you're fired, go home. So I mean, there's certain restrictions. But in general, these have this thinking process in you. So, and also, the one I put down, let's not confuse new medicine with better traditional medicine. I was a part of a finding commission for a professor for medical didactics, and he was supposed to talk about digital tools and all this stuff. And so I asked him, like, what is digital medicine for you? And he says, making analog processes digital. I said, no, that's not digital. That's basically replacing the written part with some other form of information. Digital is when you actually take advantage of digital information and do something new with it, and do something advanced with it. It's not making an analog process digital. And I think there's a lot of misunderstanding about what this actually means. So, I'm actually jumping a little bit to give you some opportunities because I'm running a little bit out of time. I think there will be a huge paradigm shift in healthcare in the next few decades, years. I think decades is even too long. We'll have all these technologies available, and we will actually have a shift from treating sick to preventing from becoming sick. We'll have a value-based approach, patient-centric approach, and we will have personalized healthcare. And I think every one of us would want that, or should want that to happen. We don't want to be part of a healthcare system that only treats you when you're sick and maybe even causes the third largest problem for dying, actually, in the healthcare system. And I think that technologies can actually do a lot to actually make that happen. So, another thing that I heard in my last conferences that I attended, we are not, medical technologies is cool, we will actually treat some things, but we actually need to understand significantly more about the biology of life. How do cells recuperate, how do we get rid of senescent cells, what is the immunobiology set up, because that will actually save or will increase our life at the end of the day. It will not actually necessarily help us to treat cancer with radiation therapy if you die of something else 2 years later. Our body is degenerating. How do we make sure we don't degenerate that quickly? This is all cell biology. So there's a lot of things coming up. And one of the things is, and you may have heard about this, is the CRISPR technology. CRISPR is able to edit genes. And the important part is, I think I'll put this up next, is 75,000 disease-associated or DNA-associated diseases are around, and 90% of them are single gene mutations. Single gene mutation. One little editing process could change that gene around that causes a certain disease. Now, I think that opens up opportunities for living longer and for staying healthier a long time. So I put a lot of things on this one. I'm not saying again that we are here in the segment that is not future-proof, but I think there's a lot of the things that I talked about living longer is actually coming from the biology side. So we have seen that we actually work on this high design principle for generating innovation, and a lot of there's Jimmy Moore out there and also John. I think we all kind of like work based on this principle. It's going out and talking to clinicians, finding out how they work, what they do, and trying to understand the problem, which I started this presentation with, and then ideate around the problem areas that we see. Maybe then later on implement that in the startups. One of the things is that is very important here is that part disruptive technology. Typically, we start with an incremental problem because that's what we call for, that's what we analyze. But at the end of the day, when we understand the problem, we should work into disruption. We should try to actually make things dramatically better, not 10%, dramatically better than before. And please don't, when you look at things, work like Gilbert, don't drink too much alcohol, but alcohol in general actually helps to do some developments. All right, in summary, future developments there will be a lot more based in home care. There will be a much later transition point where people decide to actually move from home care approach to the ability to go to a doctor. There will be some technologies involved, and there need to be some attributes involved. They need to be effective, easy to use, cheap, all the things that we don't really like doing at the moment as scientists, because You don't get research money by saying, I do the same thing, but I make it 10 times cheaper. You don't get research grants for that. So maybe we need to cover that up a little bit and still make it 10 times cheaper and put a couple of buzzwords on it. You need to make it easy to use. We are in a domain in healthcare where we are doing high tech for people that are low tech. Our users are not high tech users. Our users would like to have one button to push, and then it does what it's supposed to do. They don't want to have 17 dials, and they want to have an expert to use it. They want to have something easy to use. That's very important to them. And also we do error mentions. And then a lot of technologies you can employ to do this. There's something which we have not explained, but blockchains, for example. I always think about blockchains when I hear the talks about the guns, you know, all these fake images that we have, that we're dealing with. Yeah, it's good for training. We need to make sure that they don't make its way into real training, into real application. We need to just save patients' privacy as well. But I think there's a lot of things that will happen with technology that you should be aware of. So 5G will come. I also show you a picture of Siemens. That's kind of cool because Siemens thinks in the meantime also that way. They've also understood that they cannot continue to sell expensive devices, but they need to protect everything that is associated with health. They need to connect within their own system. They create a digital twin, they call it. And they want to connect all the data you get from the blood samples to the urine samples to the healthcare checkup to the MRI system, plug it all together with some AI, and some magic happens and they tell you if you have. That's what they want to be part of. So even the big companies have understood it now that systems is maybe not the future. The future may be connecting this all together and trying to draw some conclusion from the data. So there's no blame for the big companies though, but I firmly believe that real problem solutions can only come from entrepreneurs. So I would urge you to consider at some point in time to become an entrepreneur, because then you can really do things that you believe are right. And you can change things. Large companies try to actually maintain their status as long as possible. And you need to obviously understand a little bit about commercialization. So don't stand behind the wall and say I'm an engineer, I'm a technologist. No, you need to know what is good for the patient, you need to know some ethics, so you have a chart on this one later on too, and you need to understand a little bit about economics. So, we need to shift from prevention to home care. Please consider and always remember healthcare is global. So whenever something does not happen in your own country, in your own environment, it may happen somewhere else, it may be needed somewhere else. Please think that. So you have a lot of international people here, and one of the things I really like is connecting these people together. When you have an idea in the UK or in Holland and says, doesn't really work, you call your buddy in India and say, you know, I have this idea, does it work with you guys? How does your system work? And this can actually create a lot of value to everybody. And I believe, I said that before, I think we need to change the curriculum of the education. I think you guys need to know from the technical side a little bit more about the medical side, but I also believe the medical doctors need to know a little bit more about technology. I think they're a little bit blind on things that happen. So please, while you do this, consider these 4 things as very important. I also believe that we should teach students on the engineering about ethics, about honesty, integrity, which we also don't do. But this is a very important thing because we are at the beginning of the development chain. So we put shitty data in that creates problems, there's a shitty outcome for the patient. We have a shitty algorithm that is not proven or validated, that would be a shitty result at the end of the day. We have a responsibility as engineers. So please consider that and have that in mind. So be fair, honest, positive, creative. And actions, my wife always says, actions speak louder than words. Talking about it is one thing, doing it is another thing. Please do it. Okay, my personal advice, quick rundown, I have only 3 minutes left, which means you have no questions. So, focus on the problem, most importantly, not on the product. A good product that you can sell is a shit product. So please think about the problem first, that's most important. I stole that from Bill Gates, doesn't tell you anything yet, think weak. Try to actually educate yourself continuously. Try to learn continuously. Create a think week. So he used this part, power of guilt. So build yourself a tower of guilt. Actually, I made the effort. This is my tower of guilt. This is a picture of my office. And I have actually started reading all this book, but I've not completed any one of them yet. The only one that I've almost finished is some deep medicine I mentioned before. I built myself a tower of guilt. Why do I do this? Because it reminds me that I should read. I should do this. And I built this up and I create for me a visual guilt tower. And I do actually, and it happens quite often that eventually I take one of these books and finish it up. And this is so important that you learn more and that you actually get a wider view beyond your biomedical engineering experience. Okay, please consider all these things that I mentioned right now. Who pays for healthcare? How do we move from reactive? How do we democratize? All the things that are important. Of course, there's also some regulations I put down and ethical issues. But I really believe that regulation should not be your foremost thinking process because it stops you from innovating. And all of them provide international innovation opportunities. There's lots of things you can do if you really do it smartly and do it together. And please also, money's not everything. I'm grown up. When I was your age, the green movement started. Nobody was throwing anything away. Everybody was extremely conscious. It has reverted a little bit. It's coming back now again. Please think about the planet. Profit is not everything. So I put together things that I believe are the recipe. So we use exponential technologies. They will lead to a paradigm shift. I will put this. They bring disruption. They will address cost. Please look at this one here. This is from a very famous surgeon, he's a hospital. They do heart surgeries for under $2,000. They cost in the US $200,000. And this is the same quality, by the way. We have a shift from outpatient service to inpatient or even to home care, and we will have a more empowered patient. And I think these are the things that will happen. This happen in your mind when you have to develop things. And this is something that I would really like you to also remember. Try to create painkillers for burning problems. Typically, researchers do painkillers. We have a very cool solution. What problem do you solve? I mean, that one we don't know. So we have a painkiller, but we don't know the burning problem yet. And I'm just trying to, maybe redirect your attention to the burning problem and then try to create a painkiller for it once you have identified the burning problem. Okay, summary, quick one. I'll just try to add them all up. There is a lot of disruption needed. Please think 10 times, not 10%. It's not 10 times more difficult, or 100 times more difficult, but it would create 100 times more impact than 10%. It is not that much more difficult to completely rethink a process rather than trying to make a process easier. And I think there's a lot of opportunities, entrepreneurial activities, and I think I hope you should be a little bit more interested in actually trying to do things on your own. So please also remember there is no medical technology, it's a combination out of everything. There's many technologies involved, and there's huge innovation potentials in the whole thing. And I think I have one more. Please go visit our lab. Some of you have done it already. If not, go somewhere else, because that's kind of like what we follow up. We try to follow this bio-design process of trying to identify problems more often. And don't look at your iPhone all the time, which I do also, because it may change a lot of things in our brain in the future. I see that with my kids, they can't take their hands off anymore. I have a hard time myself, I have to say. But please think that there's something else outside your life. And maybe that's the important one, which is outside your life. This one here. Sleep more, very important. 8 hours sleep is important. Meditate. Some don't like that. I'm a very non-esoteric person. I still believe in meditation. It's actually cool. Spend some time with family and friends. It's very good for your personal development. Move more. 10,000 steps, please, every day at least. This is good. That's all you have to do theoretically, sports-wise. Learn more. Think about the tower of guilt. Eat better. Oh, it's difficult for me too. And I like beer, so I'm from there. Of course, unfortunately, you can't do the last one. Choose your ancestors wisely. You have a good base at home. All your ancestors have been 95, then you have a very good chance to be 95 without ever having to see a doctor. But this is some of the advice that I give you, and of course, be open and ask questions. Be open, be always curious, and ask questions wherever you can. Questions will actually help you a lot. So you can ask some questions right now. I don't know if we have any time left. And other than that, I'm hopeful that my club will win at 15:30. And you know which one I root for based on the size, right? So I don't know about Friebe, where are you? We can watch it, so we have to sit here, but we'll see. And but you check right now, okay? So thank you for your time, thank you for your attention, and if you have any questions.
So maybe you have no time for questions, but maybe one comment from my side. Yeah, just believing in technology is nice, but I still believe in believing in having your own choice. So actually, you should be the one who has a choice to do that and to have the freedom to do that and the ability to do that. And this is maybe the major point on having all these technologies that we maybe in future will not understand anymore. And that's maybe the point. So I think we can discuss a lot later on when we have a beer.
That's right. And it's, by the way, beer from my favorite brewery here in Magdeburg. It's a local beer. And it's basically, Axel and myself, let's put it that way, we basically put it on the expense of our account, so please take advantage of it, right? And drink as much as you can.
We will have a short 2-minute bio break coffee pick-up when we set up the presentation of John Hollistein, and see you in a few seconds back here for the next presentation. And take a bottle.